As vaccines are rolled out and thoughts turn to going back to the workplace, how should health and safety practitioners continue to keep employees safe and use their influence to manage the difficulties to come? Employers have a responsibility to protect the health of their employees and others who may be affected by their undertaking. This includes people who may reasonably be exposed to contact with biological pathogens as part of their daily work. Regulations assert a duty of employers to assess the risk to staff and to put in place appropriate controls to mitigate that risk. But despite all this, as well as media stories to the contrary, the consensus among lawyers is that employers cannot force their staff to have a COVID-19 jab.
Part of the problem is that COVID-19 is not an occupational disease in most cases. It doesn't originate from the workplace unless you are a health worker or an individual working directly with the virus as a consequence of your work. Vaccination is the answer to preventing infection and limiting the spread of COVID-19.
It's not just hygiene measures and restarting systems that health and safety professionals need to focus on before they return to normal operation. In some cases, training certificates for skilled work, such as driving a forklift truck, operating a chainsaw, or even administering first aid, will have run out. The training organizations will probably be fully booked. Those employees whose certificates are still in date will be pressed to work longer hours or more shifts, while their colleagues wait to be recertified, all of which affects the risk profile.
You have to look at each activity and say, what's the COVID risk? And then apply the hierarchy of controls. It could be as simple as putting up a perspex screen, implementing a one-way system, or limiting the number of people. You've got to assess the whole operation. And also consider that implementing COVID controls could unintentionally create new safety risks.
For office-based staff who have spent most of the past 12 months working from home or not working at all while on furlough, the risks in the return to work come not from any lack of technical certification, but from the potential stress associated with a return after a long absence. So, how can you ensure a safe and successful return to work? Make sure your workplaces are clean and hygienic. Promote regular and thorough hand washing. Promote good respiratory hygiene in the workplace. Ensure that face masks and paper tissues are available, along with closed bins for hygienic disposal. Brief your employees, contractors, and customers that if COVID-19 starts spreading in your community, anyone, even with a mild cough or low fever, needs to stay at home. Read all this and more in the latest issue of IOSH magazine.